of you probably want to know, what is Fraxel? Fraxel, yes, it is a laser. It targets aged, sun-damaged, and acne-scarred skin. It uses microscopic laser columns that penetrate deep into the skin. The laser only treats a fraction of the tissue at a time, which basically means it leaves the surrounding tissue intact, which promotes rapid healing. The Fraxel resurfaces the skin by stimulating new healthy skin cells from the inside out. So you can watch it surface away pigmentation, and it also helps stimulate collagen production, which creates an even depth on the skin's surface, which helps repair acne scars. Now quickly, Fraxel is not suitable for those who are pregnant, breastfeeding, or those who have hormonal-based pigmentation like melasma. We also do not like to perform Fraxel on people who have a darker skin type. So in the Fitzpatrick scale, if you sit between a 4 and a 6, we do like to be mindful in treating those clients. So I want to introduce Marissa. Marissa has been coming to the clinic for over 6 years, is that right, Marissa?
Yeah.
So Marissa is, Marissa did have some bad acne growing up, which left her with some pitted textural scarring. So we can see through the cheeks here, if you want to come up nice and close, we do have a little bit of this textural pitted scarring. However, Marissa has had up to 8 Fraxel treatments, I believe. We had 5 Fraxel treatments in the first year, and we've been having 1 as maintenance ongoing yearly afterwards. You can really see how that collagen has really kind of created that spongy, beautiful texture to the skin and evened out the depth of her acne scarring. So Marissa, you are somebody who's, a big advocate of Fraxel. So tell us about, where your journey's taken you with your Fraxel for your acne scarring.
It's a completely different skin from where I first started to where I am now. There's no comparison. It has changed my life and it really does work. Yeah.
And what would you say for those who, kind of want to start on their acne skincare journey and treat the scars? Would you recommend this for them?
Don't wait. Get onto it.
And also Marissa has had Fraxel for some pigmentation as well. So it's kind of really even out the pigment. So, obviously you recommend it too for some pigmentation to even out the skin.
Even just to rejuvenate your skin and get it looking fresh and plump yearly, I definitely recommend Fraxel.
Yeah, I can vouch for that as well.
You feel a little bit of a pinch and it's quite hot after the treatment, but only for around half an hour after.
I'd like to also mention that we do put on a prescriptive numbing cream on the skin, so that takes a huge edge off. At the clinic, every person who treats are a registered nurse, and only registered nurses and doctors should be touching a Fraxel machine. What we're going to do tonight for Marissa's Fraxel is we're going to do our mini Fraxel for all over her face. We're going to really focus on this light epidermal pigmentation. We can kind of see through the cheeks, all through here, this light pigmentation, and then also, sorry Marissa, goggles up, and up on the forehead as well. So this means that we're creating a tailored Fraxel treatment for Marissa, which we absolutely love to do at the clinic because we know that not every single skin is the same. Ready? Okay, Marissa, how's that?
Can't even.
Great.
Yeah.
So this is our mini Fraxel setting. To be honest, it really shouldn't feel like a lot.
It is not painful.
Okay, so the reason why we do this mini Fraxel is, like I mentioned, to help with that light pigmentation that we see from sun damage that, to be honest, a lot of us have because we live in Australia, we drive in the car, you can see that pigmentation form on the skin. So this is just a really safe, effective and quick way to treat that pigmentation. You can treat pores like they're scars, and what we want to do is promote that collagen underneath the surface of the skin to create that smooth, even texture, which is what we absolutely achieve when we treat for pores. And that's what I personally noticed during my Fraxel treatment. We created a mini Fraxel to minimize the downtime. It's for somebody who doesn't have a lot wrong with their skin, so very light pigmentation. It is quite honestly half the dosage that we would use for our regular Fraxel. So as I mentioned at the beginning, a regular Fraxel would definitely have almost a week of downtime, whereas our mini Fraxel is between, honestly, 3 to 5 days at most. When that person asks about the pores, this is exactly what we're focusing on the nose. One more time, clear on the nose. The thing that we really need to be careful of is how many we do. So we're not going to over-treat your skin so it ruins your natural pigmentation. So that's why we like to space them out. And that's why for Marissa, she's had zero, discoloration with her skin whatsoever, even though she's been having really regular deep Fraxels, and it has not impacted her oily skin at all. So the difference between Mini Fraxel and Dermapen, they are completely different modalities. This Fraxel is a laser, as I mentioned, so it penetrates these microscopic laser beams that create a burn injury in the skin. Whereas a Dermapen is basically skin needling. There is no laser, there's no heat behind it, so therefore you're not able to get the same penetration of injury as you would with a Fraxel. So therefore, I say to people, having a Fraxel like a Mini Fraxel is almost like having 2 or 3 skin needling sessions in one go.
I've had the needling, and the results between a Fraxel and the needling is the Fraxel is a lot, more prominent.
And now we're going to work over to our deep Fraxel for our scarring. So what Marissa's going to expect after her Fraxel tonight is her skin to feel quite a bit hot, like it's been, sunburnt pretty much. The skin will probably be red, definitely for the next 24 hours or so. Marissa always says that she loves how her cheeks look after her Fraxel.
They look really plump after a Fraxel.
What we're doing for Marissa tonight is, like we said, a bit of a tailored treatment. It's working for her pigmentation as well as her scarring, but you can absolutely just come in and have that area of scarring treated. We also treat with Fraxel post-inflammatory hyperpigmentation. So that's that red scarring that we have on the skin after a breakout. That is really effective in kind of wiping clear that scarring also. Marissa, do we get peeling or flaking after the treatment?
Yes, you do, except it only lasts, really, the downtime's only 5 to 7 days. And you just don't pick the peeling. Don't pick it.
So what a lot of people find is 24 hours afterwards, you're still really red. Your skin might start to darken a little bit. You start to notice these kind of little dots on the surface of the skin, and that you can feel it's almost like sandpaper. We do have some clients that quite honestly peel. Some get more of a general flaking and just dryness. We at the clinic we make sure that we give you the appropriate aftercare. So every single client will have, a cleanser, a really thick balm to keep the skin really hydrated, and also a sunscreen. This is something that we do at the clinic, is use a Societe Rejuvenating Peptide Mask after treatment. Reason being, it's semi-permeable. So what that means, it allows heat to escape. So Marissa's feeling really hot, so it's going to allow the skin to release that heat. But it's going to really hydrate because it's got that hyaluronic. Marissa will go home now with her post-care kit. She'll cleanse and moisturize for the next 3 days. She will then be using a sunscreen in 3 days' time. Marissa also now will not exercise, definitely for the next 24 hours. No sunbaking for a few weeks. It's winter, so we're lucky. And then we'll see her back here in 2 weeks for a review. Just to recap, we do have that Fraxel special, so it's $1,000 instead of $1,500 for the face and also the décolletage. We do also perform Fraxel on the neck, so we're happy to talk about, bundling it into a package or treating the neck by itself. You can do that by either, if you're local Sydney, come on in and see us in the clinic, and you can have a consultation with one of us registered nurses, and we can, figure out which Fraxel is best for you. And then obviously for those who can't get to us in Sydney, we do have our pigmentation kit online. And it's ranged between normal to oily skin, and so that can just start that pigmentation journey for you. We do have our video consultations online, so you can head over to theclinic.net.au and book in for a video consultation.